Hey guys, I'm Dr. Bob Mason, and in this short video I want to share with you a couple of tricks, a couple things that you can do at home if you're suffering from radiating nerve pain that comes out of your neck, down into your shoulder, into your arm, and ends up into your fingertips. And the pain is always described as a sharp, stinging pain, burning sensation, throbbing into your arm, numbness, tingling into your fingertips. If this is you, make sure you start working on these things that I'm going to share with you here in just a second. The pain always comes from a pinched nerve. And so what I'm going to share with you is helping to get pressure off of the nerve and help eliminate this problem. If you have a job where you're having to work on a computer for a long period of time, if you're working from home, if you're going to school, if your job requires you to do this, make sure you take breaks during the day, because the worst thing you can do is sit in one spot for a long period of time when you already have pressure on a nerve. It's just going to make it feel much, much worse. You set an alarm, you take a break every hour, get up, walk around for a couple of minutes. That'll reset the muscles in your neck, reset the muscles in your upper back area, and that's going to make you feel better. All right, second thing that you can do is, at the end of the day, make sure you lay on a hard surface, like whenever you get home from work, you lay on a hard surface like the floor in your bedroom, roll up a towel, put it under your neck, pin your shoulders into the ground, and just lay there for about 12 to 15 minutes, and that'll help to get some pressure off of the nerve also. You can lay in your bed with this, but I find the mattress is usually so soft that it doesn't have the same effect as a hard surface. Just make sure your shoulders are pinned back, shoulders are open, towels underneath your neck, and just lay there and relax. And then the age-old question is do I put ice on this? Do I put heat on this? I recommend both. You start off with the ice, 15 minutes where the pain is in your neck, your upper back area. After 15 minutes, take that off, put a hot compress on for another 15 minutes, and you flush the toxicity out. You get rid of the inflammation. Then you flood the body with heat and blood flow to help promote healing in that area. And then the last thing I will say is, if you have been suffering with this problem and it's been longer than 2 weeks, this is when you need to get it checked out by your healthcare provider. And one of the main questions that I always hear is, who do I go to? Do I go to the orthopedist or do I go to the chiropractor? Is I always recommend trying the least invasive therapies and treatments first, which would be going to the chiropractor, as opposed to going to the orthopedist and working on injections and sometimes spinal surgeries. Do as much as you can to avoid that. And what the chiropractor is going to do is look for the alignment of your spine, see if it's the spine that's putting pressure on the nerve or a muscle imbalance that's causing the problem. Most of the time I find that it's both, but if you can correct that area of your spine, you take care of the problem naturally, and you take care of the problem for good so it doesn't keep returning. As opposed to medications that take the edge off, you feel immediate relief, but 6 months later the problem can return because the alignment has not been changed. So those are the difference between the two professions that I see as a chiropractor. I always recommend starting with the least invasive process first, and if that's not working, there's definitely a time and a place for medications, for surgery when it's necessary. So hopefully you got some great information from this video. Feel free to check out my website, download my free report where I'm going to show you the top 5 exercises that you can do to strengthen muscles in your spine, and then also the top 2 exercises to avoid that are going to actually cause these nerve problems. And I see patients all the time that come into my office that did these 2 exercises. That's what brought their nerve pain on to begin with. So download my free ebook. It's delivered to your inbox immediately, so you can start working on strengthening your spine and then eliminating the things that cause it.